My name is Thomas Carpenter. Now I'll be working on my patient, my wife, and I'm going to be using the Sager traction splint and demonstrating how this works. This is what we carry on my cutter. Obviously, before I apply any splint, I want to make sure scene safety, proper PPE, ALS goes en route. So we're going to check the pulse, bilateral, and then we're going to sensory. So can you wiggle your toes for me? Good job. And then inside, outside?
Inside.
Inside, outside?
Inside.
Good job. Okay. So we do that before we apply any splint. It's very important. With the traction splint, this is for adults. This can be used for both unilateral or bilateral fractures of the femur. And when you're using these, you gotta realize that when you break a femur, the patient's losing 500 to 1,000 liters of blood on average. And if the bone's protruding, it's gonna be a lot of blood on the floor. So you want to be mentally prepared for that, but also if they're not protruding from the bone, their body's bleeding internally and dumping a lot of blood. So you want to kind of move pretty quickly. And usually if this is trauma induced, you're gonna have somebody holding C-spine while you're working. And this is a life threat, so you want to tackle this first before you continue with your trauma assessment. So you want to make sure if you're really using this, all your straps are backed out before you put on the patient. And contradictions to this, as I'm going, is going to be any type of foot, ankle, tib fracture, or any fracture to the pelvis. Just because this is going to create a lot of tension, and it's in the name, traction, and it's going to pull. It's going to pull you want the legs to pull away from the body so that bone can strain out. And if it's pinching any vessels, arteries, veins, it'll strain out and hopefully get that blood recirculating, and that way you can work. So as you're doing this, I'm not really lifting the patient's legs at all. I'm fishing all the straps underneath the patella, the knee area, any type of air pockets I have underneath the legs. I'm fishing all these straps underneath. I'm pulling these pretty tight. This is made for unilateral or bilateral breaks, so once I think this is pretty tight, you feeling good about that? It's pretty tight. Once I feel like this is pretty tight, I'm gonna pop this red bar up, pull it to 15 pounds, because we're working on her patient's left leg. It's broken. So this is gonna pull the metal out. It's on springs. It's gonna pull it out. And that's 15 right there. So her body's getting pulled right now. And once we're done that, we're gonna take these straps right here, and we're going to properly secure this thing so we can go on the backboard and load it up. When you're doing this, you want to make sure all these straps the Velcro hooks up so it doesn't get caught on any non-skid or anything like that. And Alexa, stop. And when we do this, my wife's baking brownies right now. When we do this, we want it nice and tight. Feel pretty protected. We'll get it further up a little bit. If this was on my boat, I would be using gauze for padding. This one's going to go on top of the kneecaps. Like I said, I'll have multiple people holding her down. C-spine, just assisting with these straps. There's a lot of them. Get that backboard ready to go. All right, then this strap. The strap just makes sure that the feet are together. Nothing's gonna come loose, come off. We're just gonna cross them, go underneath the feet, pull tight, and make sure when I pull tight, I can still get that pulse. Still get that distal pulse right there. So that's pretty good. She's strapped in. We're gonna get the pulse, bilateral, make sure I got even pulses. Can you wiggle your toes for me, ma'am? All right, just wiggling your toes. Inside, outside?
Outside.
Good job. Inside, outside?
Outside.
Good job. Awesome. And then we're gonna backboard her, get her out of here. And that is the Sager femur traction splint. Thanks for watching.